Public testimony is limited to 3 minutes. There is a timer to your right. It will beep once when you have 30 seconds left. It will beep continuously when you have reached the 3-minute mark. Please end your remarks at that time. Right now we have 2 witnesses registered, and the chair calls Jenny Denk. If you'll please state your name and who you represent for the record.
Yes. My name is Jenny Denk, and I'm a music therapist with Brookdale Hospice and also the president of the Central Texas Music Therapy Association. All right, good afternoon, Mr. Chairman and the committee. The American Music Therapy Association defines music therapy as the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. Simply stated, it is the intentional use of music to create a positive change in behavior. Board-certified music therapists provide live, patient-preferred music to address non-musical goals. In my work as a hospice music therapist, I provide live music via singing and playing guitar. Visits typically occur in a one-to-one setting, ensuring that the individualized needs of each patient can be addressed, responses can be observed, and the music can be altered to effectively address the needs of each patient. Music has many components, including melody, rhythm, and tempo. These elements are processed all over the brain, which is why music is an effective treatment for individuals with Alzheimer's disease, dementia, and traumatic brain injury. When music is introduced to an individual, numerous areas of the brain are activated, and connections in the brain work around the affected area. This is why an individual with Alzheimer's disease may not be able to tell you what she had for breakfast 20 minutes ago, but she can sing every word to "You Are My Sunshine." Peer-reviewed journals within the profession, including Music Therapy Perspectives and the Journal of Music Therapy, highlight and promote the benefits of music therapy for persons with Alzheimer's disease. These benefits include reducing depression, enhancing social and emotional skills, assisting in recall and language skills, decreasing agitation, assessing cognitive ability, and increasing opportunities for self-expression. In my 7 years as a hospice music therapist, I have had the privilege of providing music therapy interventions for many patients with Alzheimer's disease and dementia. I have seen firsthand how a patient who is typically reserved, minimally verbal, and frequently asleep can transform into a bright, engaged, and expressive individual upon hearing her favorite song. These moments also provide solace to the patient's family, who, if even for a short time, get back the loved one they once knew. House Bill 1376, introduced by Representative Sarah Davis last session, would have established an advisory council to study the need for state recognition of music therapists in Texas. The music therapists in Texas believe that state recognition could protect and benefit consumers by ensuring a minimum level of competency, increase access to services through state programming, and avoid confusion for healthcare facilities wishing to hire a trained music therapist. It is imperative that the Texas State Legislature carefully look at music therapy practices in Texas in order to have a better understanding of if and why state recognition is needed. Mr. Chairman, I would like to provide the committee members with written testimony from several of my music therapy colleagues throughout the state who were unable to attend today's hearing. Thank you for your service to this state, and we look forward to working with you next session on legislation to study state recognition of music therapy in Texas.
Thank you for your testimony, and thank you for sticking with us all afternoon. I really appreciate this information, your testimony, and the written material. I think it was self-evident, but you were testifying on charge number 2, correct?
Yes, sir.
Okay. Members, any questions for this witness? Yeah, Representative Sheffield.
Thank you, Mr. Chairman. I just want to support this lady's profession here as a doctor who's done nursing home work. One of the nursing homes I was working with started doing this music therapy, and they had better response from Alzheimer's patients with the music than they had anything else. So we saw it work firsthand in Gatesville. Thank you, Mr. Chairman.
That's great.
Thank you so much.
Thank you again for being here. We appreciate it.
Thank you.